Here we are going to talk about shingles vaccine. This is very important if you are a candidate for shingles vaccine, or if you are a medical personnel or doctor or a medical student or a nurse or any medical personnel who wants to learn about shingles vaccine. This is important, and especially for the shingles vaccine candidate, this is very important to know about if you are planning to get to a shingles vaccine. So first we'll talk about varicella zoster virus, more commonly known as chickenpox virus, right? Because as you know, it causes two diseases. It can cause varicella, which is chickenpox, and also it can cause herpes zoster, right? So during chickenpox, the patient develops the vesicular lesions all over the body. Then we call it chickenpox, right? In some of the patients, the virus travels along the sensory nerves and remain latent in the sensory ganglia, which are close to the brain or the spinal cord. And later in life, these latent viruses can get reactivated and produce localized lesions on the skin. We call dermatomal distribution in certain locations of the skin that is supplied by that particular nerve. So there will be localized vesicular lesions. Then we call it herpes zoster. So it can occur years later, decades later, right? Usually at the old age, around common after 60 years of age, right? So that is what we call as herpes zoster shingles. But the problem is with the herpes zoster is it can produce complications like it can affect the eye and can affect the vision, right? And most importantly, it can produce pain that lasts more than 3 months. We call it post-herpetic neuralgia. That is the problem. Patients keep on suffering for years if the patient develops post-herpetic neuralgia. That's the major reason that we need to get this vaccine. Post-herpetic neuralgia, then also other complications that can affect the eye, right? Herpes ophthalmicus. Right. So what does shingles vaccine do? Shingles vaccine increases the immune response against the chickenpox virus. Right? Remember, it is the chickenpox virus that has been latent in the posterior root ganglia and become reactivated. So if we increase the immune response against this virus, when it tries to reactivate, it cannot reactivate because there is an immune response waiting for the virus to, immune response is waiting to attack the virus. Right? So that is the importance of shingles vaccine. So that's what we said. So by getting the shingles vaccine, you reduces the risk of developing herpes zoster, and that means you prevent development of post-herpetic neuralgia. That pain that lasts for a long period, right? That is very serious and severe pain. So first, who are the candidates for shingles vaccine? If you are waiting for your shingles vaccine, these are the criteria. So any immunocompetent person, immunocompetent means if you are a person with a normal immune response, right? If you are 50 or more than 50 years of age, if you are 50 or more than 50 years of age, you are eligible for shingles vaccine, right? You are a strong candidate. It is strongly recommended that you get the shingles vaccine if you are at 60 or above 60 years of age. It's a strong recommendation, right? It's also given to immunosuppressed patients who are 19 years or more than 19 years of age if they have the risk of herpes zoster. These people who are immunosuppressed are at risk of developing herpes zoster, so they are candidates for herpes zoster. The bottom line, if you are above 50, you are eligible for the vaccine. And if you are above 60, right, you are a strong candidate. It is very important that you consider getting the herpes zoster vaccine. There are two types of vaccine. Zoster vaccine live, GVL. Zoster vaccine live. The other one is recombinant zoster vaccine, RGV. Right? Zoster vaccine live is it's a live virus. Live attenuated virus, right? Weak virus. It is weakened virus, zoster vaccine live. Recombinant zoster vaccine is a very good vaccine. It's produced by DNA recombinant technology, and it's a subunit vaccine, so side effects are minimal. So two vaccines, CVL, RGV. What is the choice of the vaccine? Right? If you have to, you have two options, right? So RGV or Shingrix is the brand name. Shingrix it is the most preferred, right? That is the only one available in the USA, right? So if you go to a US hospital, that's what you get. You will get. RGV is effective. So the Shingles vaccine is also effective for those with diabetes mellitus, chronic heart disease, lung disease, liver disease, kidney disease, right? And also remember, RGV is superior to CVL in reducing herpes zoster, basically in preventing herpes zoster and preventing post-herpetic neuralgia in about 60 or above 60 years of age. Right? I mean, there are no contraindications. It is better if you avoid this. Only condition that you have to avoid RGV is if you are allergic to any of the vaccine components. So CVL is recommended if the RGV is not available. Right? RGV is not available. That is the only option you have. CVL. Right? If you are allergic to RGV vaccine, then CVL is the alternative. But remember, CVL is not available in the USA. Right? And also CVL is given usually at a single dose. Right? RGV is given as 2 doses. Right? So if the person doesn't want to get 2 doses, then the only option is patient can get CVL if he is out of the USA. Right? And also remember, CVL is avoided in immunosuppressed patients because it's a live vaccine. Your live vaccines are not given to immunosuppressed patients, and also your live vaccines are not given to pregnant patients. Right? So those patients, only option is CVL. Right? Remember, CVL, you should not take CVL if you are severe hypersensitive to gelatin or neomycin because the vaccine contains those components. And since CVL is a live vaccine, you should not take anti-herpes virus medications. Remember, varicella zoster virus is a herpes virus. So if you take anti-herpes virus medications such as acyclovir or valacyclovir, right, 24 hours before vaccination or 14 days after vaccination, right, you should not take. You should not take these anti-herpes virus medications 24 hours before vaccination and 14 days after vaccination. So that is important to remember. So RGV, right, recombinant zoster vaccine, 2 doses. It is given as 2 doses intramuscular into the muscles, separated by 2 to 6 months. First one after 2 to 6 months, second dose. Right. CVL, it is single dose. It is given subcutaneously, single dose. CVL. So what are the adverse effects? RGV, right? Recombinant zoster vaccine. Injection site reactions are the most common. Pain, redness, swelling. It occurs in about 10% of vaccine recipients. Systemic reactions such as myalgia, fatigue, headache, and gastrointestinal symptoms such as nausea, vomiting can occur, but they are not long lasting, less than 2 to 3 days usually. Right? CVL, also injection site reactions can occur, pain, redness, and swelling, and also other side effects such as acute retinal necrosis, optic neuritis, uveitis, keratitis. They are rare, but they possible adverse effects. Right? So that is all about zoster vaccine. I hope if you are a candidate, this will improve your knowledge, improve your knowledge about the zoster vaccine, and also you can know what to expect after vaccination and especially any side effect related to vaccine. Hope you enjoy the lecture. Thank you. If you found this video helpful, please like this video and subscribe to my channel. You can get new video notifications by clicking the bell icon. My Patreon supporters can request lectures and get exclusive content. Please check the description for links and more details. Thank you.